Natasha, all right. So our top story today, no surprise, is Ontario's vaccine certificate program. An update here after being down for maintenance all overnight through the morning. The province's vaccine receipt system, that is now back online if you're looking to download there. So the website, again, it was down for that regular scheduled maintenance. If you didn't already say download it or print that email from when you got your vaccinations prior to that, you can now do it through the site. Here's where you're going to need it: in a number of places that are considered non-essential, like dine-in restaurants, gyms, sporting events, and other indoor venues. A reminder, you will not need to show proof of vaccination at essential businesses at places like grocery stores and doctor's offices and pharmacies. If you don't follow the new rules, you could be seeing a fine of up to $750. A lot of questions here. So now that this system is in effect, how will we know it's impacting making an impact, I should say, on the fourth wave? How will the province decide when we end this temporary system? Let's get some answers. Joining me now is Dr. Kieran Moore, Chief Medical Officer of Health with the province of Ontario. Dr. Moore, thanks for taking the time.
Morning, Mel.
All right, so let's begin here. We know Premier Ford, along with the Health Minister and Sylvia Jones, having a news conference a little bit later on with an update on the vaccination certificate. Can you give us a glimpse into what we might be seeing? Because what more could the province be doing to make this more effective?
So I think once we have this process automated, it'll be more effective. So we have a month of learning. We'll be dealing with paper and businesses will have to be able to verify that your second dose plus 14 days to let you go inside these non-essential services. So that'll be a learning curve, and we will work with businesses and the community to try to ensure that this process is adopted smoothly and safely in all jurisdictions across Ontario.
Dr. Moore, do you think more support should be given to businesses because they're sort of put in a difficult position right now to be able to verify a document, look at it, and they're already dealing with staff shortages with a lot of small businesses. Do you foresee any issues in this process?
Yeah, I think we have to be very understanding of businesses, and they've had a rough go over the last year and a half. There'll be a learning curve. This first week is all about education, how to interpret the vaccine certificate, how to ensure that it's safe as we go indoors, and we will be minimizing any enforcement over this coming week. It really is about education of businesses and the community of how to present your certificate and how it should be used appropriately to keep our indoor settings safe.
Indeed, we're looking at safety. We're also looking at helping the economy. But there is a lot of gray here. How long do you anticipate this to be in effect, this passports or certificate program?
We'll have to follow the data. That'll be a data-driven decision. We know that this virus wants to spread more aggressively in the cold months as we go indoors, as the humidity levels go down. And so we'll be watching the data and the risk. As soon as we have a high enough immunization rate and the risk is down, we want to remove most public health measures sequentially over time. And so we do have an end game for the pandemic. We're dealing with Delta right now. We hope there's no new variants. And we have a plan to stop public health measures over time by monitoring hospitalizations, number of people in our intensive care units, the amount of people that have taken up the immunization. And really across Ontario, we're doing brilliantly. At 85.2% of our eligible population has taken up first doses, and we'd love for them to finish their second doses and more people to come forward. Immunization and prevention is our means of getting out of this pandemic.
I want to get to the school setting. We are seeing, in your words, sort of minimal cases. This is not unexpected. We knew there would be more COVID-19 cases as the school year picked up. Obviously, there's more exposure. So I believe there are about 1,000 active cases related to Ontario schools right now. That's compared to last year. There were 91 cases. But for anyone who is at home, a parent, a teacher, or a student, and they're being forced to self-isolate, a lot of people putting up their hands saying, how can we make this more efficient? Why can't we have rapid testing so the kids can go right on back to school? Is this a money thing? Is this an inefficiency you think of resources? Why can't that happen?
Also, just for your information, if you're vaccinated and you've had a high-risk exposure in a school setting, you will be provided a PCR test. Hopefully it can get done in a very quick time frame. If it's negative, you are back in the classroom. So there is rapid access to testing. If it's negative, you're back. And that can be as short as 24, 48 hours. If you get the testing done quickly and the interpretation and the public health says, fine, go back. So that is done on outbreak management, especially in the high school settings, where there's very quick turnaround and those that are vaccinated are returned. In elementary, where there are unvaccinated individuals, obviously, we have to wait the 10 days to see if symptoms develop. We could, over time, in high-risk communities where we really don't want to see schools closed, have access to rapid testing in those environments where the community rate's high, where we're seeing ongoing cases come into the school. Having rapid testing in that environment could be advantageous to prevent closures. I'm happy that we've had one closure to date across the 4,844 schools. We've been able to minimize that process and keep schools open. And it's a tribute to the hardworking parents, teachers, students, as well as the local public health agencies who are really doing their best to try to limit the spread of infection in these environments.
All right, we have run out of time. Dr. Kieran Moore, appreciate you taking the time to chat with us today. Thank you.
Thank you, Mel.